Attention Deficit Hyperactivity Disorder, or ADHD, affects over 6 million kids in the United States. That means that roughly 10% of all American kids may be struggling with focusing, following directions, sitting still, or sharing. This can make life pretty difficult in a lot of ways. School may be frustrating, making new friends can be hard, and there may be a lot going on at home. And it's not just the younger kids that are affected. Over 50% of US kids with ADHD are between ages 12 and 17. And while it is more common in children, for about 5% of them, their ADHD will last into adulthood. Adults with ADHD often struggle with focusing and completing tasks at work, mood swings, and unstable relationships. While all of this may seem pretty grim, there is a wealth of help and treatment options available to those who have been diagnosed with ADHD. For children under 6, a combination of behavioral therapy and parent training is usually recommended. This will help the child learn to better manage their symptoms and develop positive coping mechanisms, along with communication and organizational skills. Parents are equipped with the knowledge and skills to help their child, including setting routines, managing distractions, and being clear and specific when they speak to their child. For adults with ADHD, medication may be recommended along with behavioral therapy. The most common type of medication used to treat ADHD are stimulants. Stimulants increase dopamine levels in the brain to help regulate behavior and improve focus. They have been proven to reduce ADHD symptoms in 70 to 80% of people over age 6. Non-stimulants may also be recommended for those with a history of drug or alcohol abuse. There is also a way for doctors to monitor and train brain activity through a process called neurofeedback. If a person is not getting their desired level of success from behavioral therapy and medication alone, brain training with neurofeedback can be added to their treatment plan. By monitoring how brain activity responds to certain cues, neurologists can help patients improve self-regulation and reduce ADHD symptoms. It can be easy for people with ADHD to feel very alone, overwhelmed, or frustrated. It is important to remember that help is out there and you are not alone. There are many organizations that provide wonderful resources for parents and those diagnosed with ADHD, including the Centers for Disease Control and Prevention, or CDC, CHADD, or Children and Adults with Attention Deficit Hyperactivity Disorder, and CHADD's National Resource Center on ADHD. If you or someone you know may be experiencing symptoms of ADHD, do not be afraid to reach out for help. There is a vast community of psychologists, neuroscientists, and fellow neurodivergent people who are equipped with the information and advice to help you reach each and every goal that you set.